and it's now started. So you should get a message on your screen telling you that we're recording. So now, let me now introduce our guest today. I'm delighted to introduce Dr. Michelle Templeton of Queen's University Belfast, the Centre for Children's Rights at Queen's University Belfast. And I'm particularly delighted because Michelle and I were co-students, co-PhD students together. Back in the day, we both worked did our PhDs in the Centre for Children's Rights, supervised by Professor Laura Lundy, and learned a great deal from that experience. So it's great to catch up with Michelle again. Michelle, you've managed to stay at Queen's. When I did finish my PhD, I moved south and now located in Kildare. But I'm not going to introduce your backstory, Michelle. I'll let you do that. But just say, as a former colleague, I'm delighted to have you here doing this presentation. Also to say that we in the COVISION project that hosts these seminars, we're in the process still of establishing our Children's Research Advisory Groups, or CRAGs, and we're doing it in the difficult situation of the COVID/post-COVID digital age, where we're having to do everything online. So we've met a lot of challenges that I believe you and your colleagues met a year or two ago. You've been through these challenges before, and I hope that your experience is going to be enlightening, certainly for us and for everybody else listening. So I think I've said enough.
Before we start, can I say
Suja.
one thing, sorry. Hi, Michelle, thank you so much. Just want to highlight the funder of the project. The COVISION is funded by Health Research Board Ireland and Irish Research Council. This was part of the rapid response to COVID-19. So this is a global project. We have people across the globe is working on this project, trying to understand the impact of COVID-19 on children and what we can learn from children. So as Harry is kindly working on this project alongside with the Dr. Helen McEnany. So it's really a fantastic project. I really wanted to thank you, our funders, for giving us this opportunity. And thank you, Michelle, for joining our this month webinar. And next month, this is going to be a Children's Day celebration event. So I hope you can join that as well, Michelle. And thank you so much. And I'm going to hand over to you and looking forward to listening to your presentation. Thank you.
Over to you, Michelle.
Thank you both so much. It's lovely to get a chance to speak to everyone, and thanks so much for inviting me to come along to this masterclass. As researchers, we do love sharing our stuff with others and, you know, spreading the love, share the learning. And it's so good to connect up with Harry again as well. Back in the day, we had many laughs and many tears during our PhDs in the Centre for Children's Rights. So it's great to see Harry again and to continue on the work. So I have a presentation ready. I'm just going to go ahead and share my screen. So I want to tell you about a recent project that we conducted during the COVID. Can you see that screen okay, Harry?
Yeah, it looks beautiful. Perfect.
Lovely, nice and colourful. That logo was designed by the children for the COVID Under-19 initiative. Nice and colourful. So I want to tell you about one of the projects we worked on during the COVID pandemic, just to give you a bit of background on myself and on our Centre for Children's Rights. We are internationally renowned for our child's participation model, obviously through our director of the centre, Professor Laura Lundy, who Harry and I both worked under for our PhDs, and I continue to work with Laura all these years later, very privileged. So the work that we do is substantive children's rights issues. Laura is from a law background, but based in the social sciences. So we're concerned about the implementation of the Convention on the Rights of the Child, research on the rights of the child, child participation, including children in decision making, building their capacity, intergenerational dialogue, all that kind of thing. And we would do a lot of work for the Committee on the Rights of the Child, Council of Europe, European Union, large NGOs, global NGOs, like Save the Children, local NGOs like Children in Need. You know, we do a lot of work facilitating and developing models of child participation in their organisations, and also through research and policy making, etc. So quite a bit of experience in using and developing our Lundy model. So I wanted to talk to you about that as we're kind of going through and show you an example of one of our global consultation type projects that we have got going here, and it's still ongoing. So the COVID Under-19 initiative, that came about obviously when COVID hit. And a lot of our NGOs and ourselves were a bit concerned the children's rights maybe were not being upheld during crisis, talks and an emergency situation. And we wanted to see what was happening there for children, but also so that we could inform policy making and decisions that were being made really quickly, that we could inform them going forward. So I'm speaking on behalf of the initiative, and as you'll see, the initiative involved a lot of people across the globe, which I suppose is one of the things I want to talk about as well in terms of the challenges and opportunities. Now, my slides, there we go. I didn't hit the button hard enough. Okay, so through our chat today, I'll tell you a wee bit more about the COVID initiative, tell you a bit about the Lundy model, child's participation model, in case some of you aren't aware. I mean, I'm sure a lot of you will be aware of the model if you're interested in children's research. I'll just briefly kind of go through that and describe to you how we developed the Life Under Coronavirus survey, which is the survey that was born out of the initiative. I suppose the take-home message, I want you to take home from this talk today is that kind of balance that you have when you're working with children and young people live, in terms of, what we want them to do for us, what our goals are and what interests them and how they think they should do that. Of course, all in an ethical way. I'm going to talk about some working online. We all have experience nowadays of working online. I suppose we were lucky in that we had experience of conducting other global studies. We kind of had a bit of a heads up on the working online situation with international advisory groups in particular. So we had a bit of a heads up with that, and that was handy for us. But, obviously we still came across challenges and limitations, and many opportunities that opened up for us. I'll talk about some tips for engaging children and young people online. I mean, I would presume most people here kind of work with children or want to work with children and have thought about some of these things, but just maybe more in the kind of the international online kind of context might be a bit new maybe for some. So I've just pulled together here a few of the logos of some of the organisations that are involved in the COVID Under-19 initiative. And I think at the minute there's about 36 big children's rights organisations, universities, advocacy groups, that kind of thing, all involved in the initiative. And these were the only logos that could fit on the slide, and I didn't want to have about 4 or 5 slides with colour pictures on them, So so you can see there's some big names: Eurochild, Terra Homes, World Vision, Plan International, the International Scouts, child's rights coalitions from all the different sort of UN regions, Child Helpline International, Child Rights Connect, which some of you may know about, is the kind of umbrella group for children's organisations across the world, and they would be the secretariat for the United Nations Committee on the Rights of the Child. So we had a lot of buy-in, a lot of people who wanted to partner. Now, Terra Homes kind of led this, and what they did was they wanted to bring kind of all their partners together, so that, I suppose, we weren't reinventing the wheel, or, we weren't carrying out different things in different contexts, something that could be like a global hub of information coming through. So they came to us, obviously, in terms of the child participation element of that, and that's where we kind of came in. So one of the things to come out of the initiative was, we should develop a survey, and this could be a global survey that would go around, around the world, around all the children and young people, to see what's happening in their lives, to get their experiences, so the policymakers could be aware of what they were doing, and what was important to children to take account of when they were planning for this emergency crisis. So the survey itself, I'm not going to talk too much about the survey itself. I'm more interested in how it was developed, you know, and how we worked with the CRAGs. But it was designed around the Convention on the Rights of the Child. So it's a survey of, I think it's 40 odd questions and some open-ended questions as well. And it's broken into questions around all the rights, education, health, participation, safety, protection, all that kind of thing. So all the rights were addressed in it, and we worked at every stage, which is part of our child participation model and the Lundy model. We worked at every stage with our children and young people in advisory groups and our partners, which are very, very important in there as well, to make sure that the survey and the findings were produced with children and for children. So again, another big take home. So the development of the survey. So our starting point, as I say, is our Lundy model, where we would recruit groups of children and young people as co-researchers on the project. So we see those young people as our advisors, as our equals. Some people like to say, you know, they're experts in their own lives and whatever. We prefer to say they have some expertise to bring to the table, and other people are around the table with other expertise. So for example, survey developers and your researchers and your safeguarding kind of people, and people who worked in the content. So for example, the special rapporteur on violence against children was a big partner as well of the survey, and they informed some questions too. So to let you know kind of where we're at in terms of developing the questionnaire, before we developed the questionnaire, what we do is send out for a global consultation. So we wanted to get young people's views on what they would like to ask other children in these surveys. So what's important to them. So our global consultation received, and this was before we even started developing the survey, we wanted to consult with as many children and young people as possible because it was a global context and we needed to know those intricacies. And of course, different things were happening in different countries at different times, different lockdowns. Some schools were in, some schools were out, different things. You know, so it was important to try and capture that, you know, dynamic, organic kind of way that people were making decisions around what would happen to children and their education and their health and how all those services were impacted. So the partner organisations, again, were crucial in this aspect. And from our global consultation, you know, just to let you know, we received 270 responses from children and young people in 26 countries all around the world. But that could not have been possible without the help of our partner organisations. And our partner organisations really worked with children and young people on a day-to-day basis. They worked with them on the ground. They worked with them, you know, in refugee camps, in detention centres, in schools. So we had many contexts covered there that we would not have been able to do alone. And that's really, really important. And in particular, not being able to travel, it was really important to have partners in other countries. And you'll see as we go on, this also became really important in how we ran the CRAGs as well, because some work happened offline with the partners, and they would feed back to us, and that was very important too. Questions. So we would develop a facilitation pack at the start of a research project. So it would be guidelines, ethical guidelines, methodological guidelines for people working on the ground. And how we wanted them to do this research, basically building their capacity to do the research with the children and young people. And we would have tasks, you know, like a kind of a manual that they would go through, so that it's kind of standardized, but it's open to be adapted to their particular contexts. And that's okay too, as long as we capture that and, you know, they let us know they adapted it because, or here's why they couldn't do something. And that's all really important learning as well, and very welcome learning. We, in our facilitators pack, again, they would be translated into many different languages. So you can see straight away, before we would even plan a research project with children and young people, there's a lot of back work that needs to be done to make sure we're accessing as many children as possible. And getting the right questions in there and getting the right things answered. So a feedback template would have come back to us as the researchers. Again, would need to be translated 2 ways, translated into there and then translated back into English. So partner organisations and the time that they give up in kind to participate in these kind of things. Again, I can't overstate how important it is in terms of translations and accessing children on the ground in different countries. So feedback templates would come back, we would go through it, we made grids up of the types of questions that the children wanted in there and what they thought is important for children. So it's important for them, then it's important for adults to know what is important to them. So for example, in the education section, we had, you know, lots of lovely questions on, you know, the impact of decisions in their education, you know, but for some odd reason, we had missed out questions on examinations and assessments. And of course, a lot of the children across all those countries, all different age groups, thought that was really important and needed to be included in there. So of course they were right, and it is very important. Some of the questions, so it's important to also talk about what you don't include. So when children give you their suggestions, what you don't include and why. And it's okay, you know, you don't have to include everything, every suggestion everybody makes, but what is important is to feed back to the children and young people to let them know that's a great suggestion, but maybe not just for this project because, and it's important to tell them why. And, you know, from our research and our evaluations, children find that really, really helpful. And for them, that's the difference, that can be the difference between tokenistic kind of participation, taking their stuff and running off, and meaningful participation in terms of giving back, providing feedback, keeping them involved, keeping them up to date, lines of communication, and also letting them know where their views are going, how their views have changed and shaped this, and what wasn't included and why. So, I mean, for example, some questions we had to exclude because things on ethical grounds, maybe they wanted to ask about violence or, you know, something, sexual abuse, something really specific, you know, that we felt this maybe wasn't the appropriate way to do that, but that might be done in better and maybe different methods, for example, a more qualitative research, maybe more smaller. So ethical grounds, incompatibility with the methodology, or maybe because the question wasn't directly related to children's rights. So it may be something like, you know, about children sort of, you know, do they feel more loved and less loved? And, you know, maybe not directly related to rights language. But what was really important was the grid that we did up to feedback to the children and young people. We kept a separate list of questions that were important to the children and young people that we didn't address. And what we kind of suggested to our partners was, here are some questions that the children and young people said were very important. You might want to do further work around these or plan other projects around this. So their suggestions weren't binned. You know, they were kept, they were passed on, they were explained why their suggestions were included, why they weren't. And for the most part, they were happy with that. We got feedback as well to say they were happy with that. And partner organisations thought it was good as well that we were able to pass those on and give them information that they could investigate further with the children and young people. So that was good. So that was before we even developed a survey. That, you know, that all that back work was done, and that took a bit of time as well, and translation and stuff took a bit of time. Obviously 26 countries with many languages there to be translated. So getting on to our CRAG then, once we had that information and we had developed kind of prototype survey, which included the views of all the stakeholders around the tables, it went through many iterations. All those kind of partners had a look at it and put in a question and queried things. The children and young people's stuff were put in, and again, a prototype of the survey was passed around, it was shaped up. And then the last thing we did with that was to run it past our CRAG. So for this project, our CRAG consisted of 25 children and young people aged 8 to 18 from 28 countries around the world. Many languages again were spoken. So what they did was they refined, we met a couple of times online during workshops. They took the survey offline as well, worked in peer groups or maybe worked with their partner organisation. They went through, they refined the survey in terms of the wording, they identified priority areas, you know, so if you can imagine with all those partner inputs, the survey was getting just bigger and bigger and bigger. So the children were very good at pulling us back and saying, hold on, this survey is for children, it's far too long. and rightly so. So they were able to identify priority areas and areas for things that we needed to cut that might have been important to partner organisations, but they felt weren't so important in the bigger detail for children and young people themselves. So for example, one of the partner organisations from, I think, South Africa was very interested in a socio-demographic question around, what type of home, do you live in, what type of your living situation, and they had to put down like villages and, big cities and blah, blah, and the children and young people were really confused with this question. I thought, why does that matter? It mattered to the partner organisations who maybe work in rural city kind of work, and obviously really matters to them. But for the children and young people, in terms of their rights around policies being made in coronavirus, to them that wasn't so much important. Priority areas we had to cut, that was one of the things that was cut. Again, the survey was kind of spliced up for different age ranges. So there were 3 kind of different versions of the survey. Which jumped. So if you answered that you were a particular age, you got less questions, and the survey kind of jumped. If you answer yes or no, you jump to a different kind of part to the survey. So in terms of bringing the surveys together, some questions would have been missing for 8 to 11-year-olds that may be there maybe for older children, kind of 16 to 18 years. And that was important for the children's advisory group. They thought that some of these questions aren't relevant to younger children and some are more relevant to older children. And that was great on their part as well. The survey, just to let you know then, once it was finalised, there were 28 versions of our survey, 27 in different languages. So the survey went out in Thai, Cantonese, German, English. It went out all sorts of languages that I had never even heard of myself. 27 languages. We also made an easy read version as well, and that's really important because that was made with a lot more imaging, and that was particularly geared towards children with intellectual impairments. And it was very important for us to get that out there to ensure that our survey was accessible to as many children as possible. And as you can imagine, working online, as we talk about the challenges and the limitations, you're gearing things towards children who have access, and some children didn't. And what we did was have a paper version as well. So our partners who worked with children and young people who did not have access to computer equipment and reliable Wi-Fi, etc., maybe children who were in detention or who were in refugee camps, our partners, again, on the ground, were able to access and go into those places and help the children and young people fill in the survey. And they would have completed a paper survey, and then they came back to their desks and input it into the online survey platform, which was great. So again, making it accessible for as many children and young people as we could, given the context that no one could travel. And they were frontline workers who were able to do face-to-face work with the children and young people. And they had all their protocols and social distancing protocols in place. So just out of interest, we had almost 27,000 responses from children and young people to the survey from 137 different countries around the world, and all of the UN regions were represented. So I suppose I've already started kind of talking about, working online and the limitations, obviously during the pandemic, unprecedented times, but again, lots of opportunity there in Harbour All. I mean, I think we've all benefited from, maybe a bit of working at home, a bit of blended learning, online, offline. It does open up such great opportunities in terms of travel. I suppose one of the bottom points there, the rapport, sort of online versus face-to-face. You could say that maybe you don't build up that rapport and whatever. What we found was, because our children and young people were so engaged and we continually met with them week after week doing different things that they wanted to do just as much as things that we wanted them to do. The rapport was really strong. We had a good laugh. We had parties online where we all brought our pets, our pets and dancing and music. We did lots of fun things as well. which obviously added to the rapport. The one thing that was missing from those kind of face-to-face things for me was, you know, the kind of the relaxed, informal, having a bit of food, having some sweets, you know, exchanging gifts and presents. You know, so that kind of thing was, you know, completely missing for me. I particularly enjoy that kind of thing. Who doesn't like getting gifts and sweets? You know, we did like that kind of thing. Partners, again, I've spoke about, really crucial to have partners if you're doing global research in all these global contexts. I mean, not just for language issues, but for practical recruitment. They know the children and young people, they know how to work with them. Emotional support as well is very important, because when you're working in children's rights stuff and you're working in research, you will be exposing the children and young people to, you know, it might be some traumatic stuff that you're exposing them to, or stuff that can just trigger them emotionally. And it's really, really important when you're working online to have that safeguarding. And we'll talk about ethics kind of later on here. But partners who are there, who are able to refer them to and able to help them is paramount as well in terms of how you work ethically with young people online. IT and communication policies as well for the partners. So one of the things we found was that the partners on the ground were more likely than our university at the time to have policies in relation to online communication, because they would have to very quickly adapt their services when they were working with their children and young people and their clients. So they were more likely to have communication policies in place, which was very important for us then when we were doing our ethical applications, to ensure that our safeguarding procedures aligned and that the people we were working with had good policies and protocols in place. And that was great in terms of our ethics. I've mentioned access to equipment already. You know, we all know that, you know, what the COVID pandemic showed as well was a great inequality in terms of those that have and those who have not. Access to equipment, connectivity, and when you're working in a global context. So, for example, the likes of South Africa, when our children from South Africa would be online, they would have had particularly bad connectivity, and they would keep dropping out and coming in and dropping out. And it was really frustrating for us all because they lost a lot of information. When they came back on, we were trying to repeat stuff and bring them up to speed, and that was really, really frustrating. So connectivity was really important for us. And one of the things we did do, which addressed time zone issues as well, was to record all our workshops and record everything that we did. And we had an online platform where the children and young people and the partner organisations could access all those recordings. And that was invaluable stuff to have as well, because it would mean that the children and young people and the partners could support them to access all the workshops and all the tasks. And they had the same standardized experience as the other children and young people who were there live. If they had any questions to ask or anything they wanted to clarify, we had some of the platforms we used was Basecamp, and it's kind of like a WhatsApp group, only there's tabs for documents and feedback and things like that as well. And our Basecamp group became very active, especially as people got to know each other more and more, and the young people felt they could write in, you know, any kind of question, and there was always someone there in the admin to answer those back, which was great. And all the partner organisations were involved in that as well. So everyone could write in. Communication, key to keep the children updated on everything that's going on, because they feel more buy-in and they tend to give more as well. Distractions at home, again, was obviously an issue, and still continues to be an issue for people as we go through. You know, who hasn't had the husband coming out of the shower and walking past the camera with the towel around them? You know, who hasn't had that during COVID? You know, so there would have been a lot of distractions. I mean, for some young people, they would have been accessing a computer maybe in their school, and there would have been a lot of noise outside if children were in recess or playing, a lot of animals jumping about screens, a lot of family activity going on as well in the backgrounds. So I think just, you know, if you're working online, these are the kind of things we expect nowadays, and I don't think we're afraid of those things now. But again, just to expect things to happen and distractions to occur, and a lot of noise maybe in the background. And sometimes a lot of feedback as well from some online connections and some computer equipment, people's microphones working, not working, all those practical things that we just kind of need to get our heads around. I had a meeting today, Harry and I were talking earlier, I had a meeting earlier on this morning, and I was here in my home city, down the street from me, and I just couldn't get their online stuff working, so the meeting was abandoned. You know, so just to expect the unexpected, and that you might have to abandon plans and regroup, I suppose, when people are working at home and working with equipment. Time zones, of course, is an issue when you're working globally, and we had children all around the globe. And sometimes, and you know, we just couldn't organize meetings to suit everyone. But again, the recording worked so young people could access that, and sometimes we would swap and change, you know, and do things in the evenings and do things on Saturdays, or do things in the morning, do things at lunchtime, so that different parts of the globe weren't left out all the time, is what our kind of thinking was. But the children and young people in the evaluations told us that the recordings were great, and they were able to access them, and they didn't feel that they would have liked to have been there live. Of course they would, but the recordings, they didn't feel like they were left out, because they were being constantly updated. And the base camp communication stream was always constantly updating, with people putting in their ideas and suggestions for the tasks, etc. So they never kind of felt left out in that sense. Languages is a big issue when you're working in the global context, and it's really important that you have translators on board, and you take account of translation time. So for example, again, it's about being accessible and having as many children as possible, and that speaking English should not preclude a child from taking part, especially in a global context. Translation, you wouldn't believe the amount of time it takes for translation. It would double the time of the workshop that you plan. So for example, we would have had Spanish and French speaking children and young people. So it's important to be on a platform that allows you to have different language channels, and you would have an interpreter or a translator sitting in each of those channels. And we could click between them all, you know, to get the language that of your preference. And the important thing about that is having translators is great, and the translators are there, but the translation time, you need to give a bit of time. So when you are hosting workshops, you need to speak slowly and speak clearly, which isn't something us Irish people like, because we really talk really, really fast. So when we're doing these online, we need to speak slowly, we need to speak clearly, so that the translators have time to translate in their own language. We would pause now and again just to let the translators catch up, and we would keep an eye on the chat to make sure a translator wasn't having an issue or wanted something repeated. So the workshops take a lot more time. That's just the translator speaking to the children. The children then, when asked their views, the French speaking children, the Spanish speaking children would speak to their translator, and their translator would translate for them and speak back to us. And then we would formulate thoughts, respond back, and another child might come in a different language. So you can see that the time to get round translation and language issues can double the time of a proposed workshop. And that has a knock-on effect as well, in terms of being boring, being longer, you know, so that takes a bit of thought as well when you're working in the global context. Our children didn't mind, because obviously they wanted to be as inclusive as possible, and they understood children had different language needs. However, it does have a knock-on effect in terms of time, and some people might be sitting for a while, you know, waiting on things happening. So that, just to be aware of that as an issue. Capacity building, doing our surveys online, we did workshops, everything from data analysis to well-being workshops, and that's really important. The capacity building, to build the capacity of the children and young people to interpret, to disseminate, to do quantitative data analysis. It was an in-depth project with in-depth workshops, and the children and young people learned loads. I suppose the thing about that was children opted to come to particular things, research methods, data analysis, online safety. They opted to come into things that they preferred, and that was interesting in itself. Ethics, again, you know, this is all wrapped up, obviously, in ethical working online with children and young people, but particularly when working online and in a global context, there are other ethical issues there around not just safeguarding and emotional impact that we talked about and signposting children on, but also about the apps and the types of platforms that you're using. I mean, one of the things we found out, obviously they're age appropriate, etc., but one of the things we found out that in the terms and conditions, so again, we would be putting this into our ethics applications, we will be checking out the terms and conditions of these platforms and the type of data that they capture and their privacy notices, and whether or not they would store any data when you're using their platforms. And the thing is that you cannot guarantee to the children and young people that these third-party platforms will not keep their information. So that was one of the things that became very important in our ethics applications, and we would make that really clear on our participant information sheets. I would put in links to privacy notices of all the different platforms, so the partner organisations, supporting organisations, the children and young people themselves can have a wee read at it, understand that, and that's something we would talk about a lot in our first introductory meetings as well, just to let the children and young people know exactly where their data is going. Very important. In terms of signposting, safeguarding, as I say, we had our partner organisations there who were invaluable. We also had Child Helpline International, and they were quite useful as well, to put their links on information sheets and on the survey, etc., and just in general for the workshops for the children and young people, as they gather together all the safeguarding organisations all around the world, and I put a wee link there to that. I'm happy to share the PowerPoint and you can have a wee look at that. It's not really child user friendly, you know, but it was the best that we had sort of, you know, at the time in terms of international global scale, but obviously referring children and young people to their own organisations and their supporting partners. I've just put a couple of links there in the bottom. Obviously, a lot of organisations like TUSLA and NSPCC, etc., have all been developing like safety online kind of courses and workshops and information. So, you know, it's important to give yourself a heads up and a read on that, even just to include in your ethics applications, things that they would point out as important for you to know. And again, talking about tips for engaging, we kind of went over it as we went along. Be flexible, try and be as accessible as possible if you're working in a global context in terms of language and the tasks, the type of tasks that you're doing. Speak to partners to see what children's abilities and disabilities may be and what kind of accommodations they may want. Keep things short, which again, when you have translation and you have work to do and tasks, can be a bit of a challenge. But what I would say is have a lot of comfort breaks in between. If some people don't come back again, then, you know, too bad. You have the base camp. You would have other communication streams where you could email and do offline work as well, and you could still engage those children and young people. As I say, we had workshops from everything up to wellbeing and safety online courses, because it was important for us to ask our children and young people at the start, what is it you want to get out of this? What do you need to know? Because this just wasn't about making a survey. This was an initiative that is still going on, and those children and young people still continue to be involved in dissemination and talking to policymakers. So it was really important to get them up to speed on public speaking, confidence, self-esteem, all those kind of workshops. And that's where the partner organisations again came in really, really useful, because the likes of the Scouts, you know, jumped in with, oh, we have a wellbeing workshop here that we do already, and someone else had something else that they could roll out. Invaluable stuff. Talking about keeping in contact, communication, they're members of your team. They are not a children's group just sitting there for you to tap into. They are members of your team. They are valuable members of your team, and they must be communicated with and kept in the loop, basically the way you would with your supervisory team or a wider research team. Apps is very important, and I've put a wee link down there at the bottom. Some places now are starting to pull together kind of popular apps and guidance for age ranges and whatever. Maybe have a wee look at that. It's important to ask your children and young people, what kind of apps they use, what they would like to use, you know, make it interactive. We were on Google Hangouts, Jamboards, you know, loads of interactive where children and young people could, you know, write live along with ourselves, post-it notes, you know, lots of suggestions, move them about, have a bit of a laugh, have a bit of fun too. We did some nice art work as well that way in the digital environment. So that was good. Again, talking about communications, having alternative channels for children and young people to engage. Some might not want to be on Zoom, some might not want to answer emails. You know, a platform like Basecamp is really good. There are others out there, obviously, and working with their partners to know what is available in their countries. So another issue, some platforms may not be available in all countries. For example, Facebook may not be available in certain countries. It's not used much, it's not popular, you know, so you need to understand and know that you may have different channels for working in different countries with different people, and that's something that you need to manage. Feedback, as I say, really, really important for integrating their suggestions, for young people buy-in, to show them where their suggestions are going. And if they're not getting taken on board, why? And then moving on to other things, constantly checking back with them, critically reflecting on how you're doing and how you're working, and changing or adding channels and adding other ways for children to be involved. In terms of dissemination online, we've had a major launch event as well. Lots of other smaller dissemination events continue. What we need to make sure is that they're child friendly and as inclusive as possible. And you know, that can be really helped by having children and young people from your group actually working with you to plan what dissemination events are going to look like, and how they can be involved, as well as the adults and what adults that they think need to know this information. So I think that's me. There's over 45 kind of minutes in. I'm happy to take some questions and stuff, just to give you a link there. So the first paper from the project, kind of summarising the survey, is out already. There's a link to it there. It's called Life Under Coronavirus, Children's Views on Their Experiences of Their Human Rights. And the methods section in that paper really outlines kind of how we did it. You'll see there that there's 20 authors in that paper, and that is really unprecedented in the social sciences. You see that kind of more in the medical sciences, where you have big medical groups involved in RCTs and whatever. We felt it was really important because for a global study, there were a lot of people involved in the development of the concept and the methods and whatever. And we actually have a young person there as well, who's the third last name, Pratik. He contributed to the writing of the article as well. So yeah, happy to take questions. I'll take this off, Harry.
Okay.
Stop sharing, where am I?
Right.
Oh, there it is. So happy to take some questions or thoughts or suggestions or whatever.
Well, thank you so much, Michelle. That was amazing. And I'm already starting to see some of the things we've done right and some of the things we might not have done right, and so on. A lot to digest there. Thank you so much. So folks out there listening, please do put your questions in. As we're still in webinar format, the best thing is to put them in the Q&A. We haven't got any questions yet, so please start adding your questions. Or you can just put reflections, comments, feedback into the chat, and we'll share those. So I think if it's okay then, I'll ask my question first while all the rest of you are deciding on your questions and popping them into the Q&A. So just to get things going, my question is the age range that you worked with. Who were the youngest, who were the oldest, and did you work with them all together, and how did they work together? Like children of different ages, or did you think of doing things separately for subgroups of different ages? In general, how did you handle the broad age range of children in that project?
Yeah, so the children ranged from age 8 years of age up to age 17. And actually, as we came to the end of the project, they were going on to 18, 19, you know, they were kind of aging out, but still very much involved in the initiative now as peer mentors. So with our new advisory groups have all been refreshed, and they are now peer mentors for those groups. So that's great, a great continuity of work as well with them. And it speaks to the young people's commitment as well, that they want to continue with this. In terms of the younger groups, we really didn't have a younger group at the start. So we had kind of starting from 12, 13-year-olds up, but it became really apparent when we were talking about trying to reach as many young people as we could, thinking about reading ability and doing surveys online, and the young people's feedback, that we needed to go down to at least 8 years of age. So it was kind of like a second group were recruited, sort of between 8 and 11, that I worked with, and they kind of came along at the end of the survey development when the young people had thought we need to split it into 3 different age groups. So we had young people there to review the 2 older age groups, but nobody to review the younger age group. So again, that was us going back out, trying to get a few more children and young people aged 8 to read this survey to see if it was appropriate for 8-year-olds, and would 8-year-olds do it. Of course, some of our young people, some of the younger ones were, you know, yeah, it's great, we do that. I mean, I had one young lad who kind of got to question 6 and went, right, I'm bored, you know, and just kind of stopped, which is fine. You know, and I'd said to him, well, you know, if an adult was kind of helping you with it and supporting you with it, would you be less bored, or would you be more likely to continue? And he kind of went, well, yeah, I'd be more likely to continue, you know, so that was good. And we kind of advertised that younger survey to the fact that, you know, an adult could support you, or a child can do it themselves, you know, whatever they feel comfortable with. And we had an ethics kind of point at the start of our survey, where we gathered information on, you know, are you an adult helping a child? You click yes, you know, and does the child consent to you doing this? And the child, you know, consent, you know, so we picked up on kind of the numbers of children and young people who might have had an adult support, and sort of why, and the age ranges around that. So the younger ones did need some adult support with that, and it was great. There was an adult to do that. But yeah, different ways of working with the different groups and different tasks. As I say, when we were doing our capacity building workshops around things like research methods and quantitative data analysis, you know, who doesn't want to go to that class? And qualitative data, you know, we did see, so we didn't so much work with ages then, rather abilities and preferences. So we wouldn't have precluded a really young child if they wanted to come along. Now, if they got bored and jumped out and left, you know, that's a different story. But there was no exclusion as to what children and young people could come along and do. And I think that worked really well.
There are 2 questions, Harry. Can you see it?
I can, yes. Thank you very much for that one, Michelle. That was very helpful to me. We have a couple of questions now. There's one in the Q&A and another in the chat. I'm going to start with a question from Danielle Kennan. I'll just read it out. Thank you, Michelle. Very interesting and great to see you again. Could you say a little more about children's involvement in data analysis? How well that worked?
Yeah, you know, well, that's a word, Danielle. Do you know what? It was actually really, really good. So we enlisted the help of, obviously, our partner organisations were crucial in this, and they had a lot of experience working with children and young people in terms of advocacy. So lots of children's rights organisations where they would gather information, for example, on child marriage, you know, and some of the children and young people had already had some experience of working in research and going out and gathering data, and that was very useful. In terms of our qualitative data analysis, it was really tricky. And what we found was that obviously we lost some of the young people along the way. The group we facilitated, we had, so some of our statistical analysis experts from Queen's were on, I was on, some of our partner organisations were on, and we tried to break the survey down into, you know, kind of socio-demographic information, you know, all the variables, and what we asked the children and young people to do was to pick sort of 3 of their top, and we did this offline as well, you know, we sent the kind of stuff offline and told in our facilitators packs, you know, we do a lot of those, telling our partner organisations to maybe to work with the children and young people beforehand, and kind of work out what is their top things that they're interested in, and then from the socio-demographic information, you know, who do they think this is, you know, who's involved in this kind of topic and issue, or who would you like to know about. So what they and we got them to do like a chart where they mapped over socio-demographic information onto their top 3. So that was very useful when we were doing the quantitative data analysis to see what was important to the children and young people, and particularly the organisations that they work with. I mean, the adults did the exact same task, I have to say. And it was useful for them as well, just to map on their kind of top 3 or 5 things that they were interested in, and map it over with the demographic. So that was very useful to do. So we did that. The qualitative data analysis, again, it was a great interactive online workshops we did, and offline as well, where we had, suites and colours and shapes. And we got the groups online using an interactive Jamboard, to kind of cluster the shapes together. And lots of the different groups clustered them in different ways. Some clustered them by colour, some clustered them by, like, these are rounder shapes, or these are spiky shapes. Some clustered them, which was really interesting, in terms of like spiritual kind of way, like this represents a number 3, like a triangle. So they pulled some things together, like a triangle, a star, and a moon. These represent elements in the earth. So people were clustering things in different ways. And our kind of take home from those workshops was, this is how interpretation works. In qualitative data, you could read it and see different things, and someone else could come along and see different things. And then we give them exercise. So after doing those kind of exercises, we had a few of those workshops, and they were very successful, I have to say. The qualitative ones were very successful. And then what we did was we gave them an example of the quotations. So again, with surveys, we had 4 big open-ended questions at the end, and we had 27,000 responses. So they had to be translated too, and then sent back to us as well. And we had 27 different languages. That was a lot of work in terms of translation and data, to come back to us. In terms of ethics, data sharing policies, they all had to be tight for ethics in terms of sharing all that, because that data would not have been anonymized, as we didn't speak those languages. So that was an issue as well for ethics, confidentiality agreements and stuff with partners to do that. So we would have given that, after doing those kind of cluster exercises, we would have given the children and young people, say, about 20 random quotes. And we kind of says to them, now offline, working with your support organizations and whatever, there was instructions on, cluster them, and, for each cluster, kind of, what do you think is going on there? So we got great stuff back to add into our briefings. And what we did was we added the children's interpretation into all our briefing. So we produced thematic briefs for every kind of thematic area in the children's rights, and also for different subgroups of children. So for example, children with disabilities, or children from a refugee or migrant status. And there was a lot of different sort of thematic briefings which are available on our Queen's website, and you'll see there that the children's interpretation of some of those quotes was in there. Obviously we didn't overwhelm our children and young people with 27,000 responses to 4 open-ended questions, or like all the SPSS output. We didn't kind of do that way, but we took some random kind of things and put them together for the children to interpret, and it worked well. I mean, we could get better at that, and we'll develop that as we kind of go along, and trying to to facilitate children's interpretation. And again, there was another ethical issue there about children interpreting experiences from other children. That was a whole ethical issue for us as well. We didn't really want other children and young people interpreting other children and young people's data, So it was an exercise in sort of research methods and clustering, and what was important to them and how they interpreted it. And we made that clear in our briefings that, our young people's kind of, here was their points.
I think that was really good discussion. I think we need to have more time to discuss all these things, right, Michelle? Discussion is never going to end. But I know there are a number of questions, but I just thought the way you mentioned, it kids their developmental age, and they are coming from a different country, and how they able to interpret some other children's experience, because they all come with a different cultural perspective and different experience in their life, because it's different age group. Kari, you want to take there are 2 questions in the chat function, yeah?
Yes, and I just want to say that this business about interpreting other people's lives, that's not a problem just for children. We adult researchers from Europe, when we set out to interpret the lives from children in Africa or South America, we have no necessarily way of understanding their lives any more than children do. So it's an issue for everybody. Yeah, so there's 2 questions in the chat I'd like to do before we have to wind up. And because they both address very similar issues, I think we'll take them together. A question from Rianne Janssens: was it possible to involve seldom heard children in your CRAG? For example, young children, children with disabilities, children from minority backgrounds, from disadvantaged home situations? And if so, how did you reach out to them? And then from Debbie Shepherd-Moynes, a related question: are you connected to family resource centers where children from vulnerable families may visit? That's one of the seldom heard groups there. So, yeah. Over to you, Michelle, again.
Yeah, so I mean, one of the things we're very passionate about in our centre is trying to be as inclusive and accessible as possible. So, you know, we do go actively looking for minority voices and young people who kind of are seldom heard. But again, that's the beauty of having all our partner organisations. You know, so we had like an LGBT group, we had groups out there who worked with migrant children, who worked in camps, who worked in detention centres with children and young people who were in prisons, in lots of different contexts. We had groups there who worked with homeless children, street children in India. You know, so they were invaluable. You know, it's the partner organisations that you link up with are definitely your link to those kind of groups, and especially during the pandemic, and especially if you're working online, if you don't know these people already, you need to make friends with organisations and those groups who work with those young people, and they can access them young people for you. So for example, one of the things that we did was to produce a paper copy of our questionnaire as well, and in our ethics we had that the support organisation staff could go out to their children and young people in all their different contexts. For example, homeless children, children in detention, children in orphanages in some countries who still have those kind of things going on, that our partner organisations could go out with a paper questionnaire. So like in prisons, they wouldn't have been allowed to bring in iPads and computers and things, you know. So the paper option was a great resource, and we had photographs. Yeah, and what's great about working with our partner organisations as well, and knowing and feeling that they have real buy-in to your project. You know, we got photographs sent along with feedback templates and things like that of the youth workers actually sitting in a detention camp, you know, and there's fires going on behind them, and they're sitting, you know, with a group of children. You know, I mean, that's fabulous. That we're thinking, oh my God, and they're sitting with the paper survey, you know, and they're all sitting and she's helping them fill them in, you know, really young children in these different contexts. And that was really, really, really emotional for us to get those photographs back as well, and to think, you know, gosh, there's those children, you know, really engaging, and we're really hearing their voices. If this had just been an online survey with a university in the UK sticking it out online, you would never have got to those children and young people. So another thing that we're doing as well, just on the kind of more minority groups. So we have produced a set of thematic briefings, and it's kind of the general, you know, sort of questionnaire sort of statistics and whatever it kind of put out there. We also have specific questionnaires on like, you know, children who don't live at home and LGBT children. And what we're doing now going forward, as I say, the initiative is still ongoing, and one of the things we're doing going forward is to do more data interpretation and data analysis with all those subgroups. So we're talking about, you know, the kind of the main children's advisory group interpreting the data of, you know, homeless children, children with disabilities, LGBT children, you know. So what we're going to do is pull out all those subgroups, and what we want to do is to run those interpretation workshops again with children and young people from those particular groups, and see what their interpretation comes back with, just to make sure their voices are even more amplified and understood more than if I was sitting doing it, I don't understand what their context is and what their interpretation is. So it's just to amplify those voices, and that's what we'll be doing going forward.
Thank you so much, Michelle. I'm afraid our time is up, unfortunately. If there's one, I've got so much out of this, Michelle. If there's one big takeaway, one big takeaway for me, it's about the partnership between the NGO sector and the academic sector. I've worked in both, but I think what you focused on is the partnership between the two being the way to go. And I'm wondering, since I kicked off, Suji, would you like to wrap up before everybody leaves?
Thank you, Harry. Michelle, I really wanted to thank you on the behalf of the COVISION team and also behalf of the University College Dublin in the South. And it's nice to have this collaboration between, Queens, you're coming from the Queens, the North and South, very much a partnership effort. And thank you so much. And, we really, I think myself and Harry and many others benefited from your talk today, because we are in the middle of creating a CRAG for the COVISION project as well. I know it's so much learning, I think somebody mentioned here, the researching with the children and about children, it's a so much innovative and creative way we could do it. And, and even you mentioned about so many practical things you managed to do it. I think that is eye-opening for many researchers who is listening today, and also it will be available online. So thank you so much, Michelle, and have a good day ahead. And we look forward to connecting with you again.
Thank you so much. Really enjoyed it. Bye, everyone.
And goodbye, everybody there. Thank you so much for coming.
Thank you, everybody.
Thanks for coming.
We'll be in touch.
Thank you.
See you later. See you.
Bye-bye then.